We're going to tag team, so you got both of us up here. Hi, good morning. My name's Clifton. I'm with the American Academy of Family Physicians.
Neil Busis, American Academy of Neurology.
And we're the co-leads for the working group on messaging and communication. And I don't think it's a coincidence that we're going last in the order here, because our responsibility through this working group is to take all of the great work that all of the working groups are doing and put that together in a way that is coordinated, it's organized, there's a consistent message, a shared vocabulary across that, and put that in a way that we can channel that out and turn all of that into action, because that's what this is. This is an action collaborative, and so we're excited about that opportunity to turn this into action. All right. And this is our working group participants, and as has already been said this morning, we really owe a great deal to the staff of the National Academy. They are so well prepared when we meet that we're really able to focus on improving the tools and the deliverables, and so I can't say enough about that group. We've had a few opportunities to meet as a working group virtually by phone. Today we'll meet actually in person for the first time later today, and so we're excited to get to work on that. We've got a few deliverables we've been working on, and we'll go over those, but I did want to call to your attention that in your packet you should have a collaborative description to give you a sense of some of the deliverables that we're working on.
I was trying to figure out how to frame this group last night, and I think that the best way to do it is to talk about the process that August Wilson, who comes from my hometown of Pittsburgh, used for fences. When you think about it, at its essence, messaging and communications is getting a story that's good and getting it out to people. And so what did he do? He started out with a very, very compelling story. He told it in language that real people use. He layered the language so that so some audiences will see different things in it than others. So for example, Troy Maxon, who's the protagonist of Fences, at one point says, you know, I feel sick, I'm going to go down to see Doc Goldblum. I know Doc Goldblum. He actually worked in the Hill District where August grew up and wrote about. He consistently workshopped Fences. I saw it about 6 times. It was different each time. This presentation has been given now 3 times here, and it's different each time based on the feedback that we've gotten. And the final principle is that he adapted, or people after he died, adapted his story to different media. So I've seen Fences in the round, which is very different than on Broadway with Denzel Washington, which is very different than the film. And so we have to be adaptable to our story, our language, our audience, our media as we move forward. And so the 5 work products that we have fairly far along in development are the collaborative description that Cliff already showed you. We want to remind you that this is a draft version and that we are probably going to change it based on Orly, Avitzer's, and others' opinions to put patients even further up the paragraph list than they are now. That we are going to incorporate the language of the research, the external factors, and the conceptual model groups in there when we're talking about physician burnout, resilience, et cetera, because we want all the messages to be consistent. We have key messages which we think apply to everyone, and just like in Fences, we have an audience table where there's specific messages for specific audiences. We'll talk about principles for messages, and we'll talk about the design of the Knowledge Hub.
So when it comes to key messages, I think it's important to point out a few things here. I'm not going to go through all of these bullet points, but you know, the overriding message here is when clinicians are at their best, everyone wins. I mean, this is really about the care and the quality and the safety of our population, the patients we take care of, the people and families and communities that we serve. And so it's important for folks to understand that this is about helping everyone receive better care and have better health outcomes by having a clinician workforce that is healthy and fit. And then it's also important that we point out that this is a golden opportunity when this incredible group of organizations comes together and shares their expertise and their influence. We really believe that we can make a difference at a system level that any of us separately could not accomplish. And so this is truly a golden opportunity that we want to make sure we are taking advantage of, and that this really is about every member of the care team. And that for the team to function at its highest, every member of the care team needs to be functioning at their personal highest. And so, we are looking for solutions at a macro level, at a system level, things that will impact the greatest number of clinicians, patients, and communities.
I'm not going to read all of the messaging principles are here, because when we workshopped yesterday, we always talked about accentuating the positive, et cetera. Some speakers very eloquently stated that there may be cases where we want to accentuate the negative as a call to action. And so we're going to have to decide which audiences to message in which way, and we'll, of course, look forward to what Orly thinks about that. What we want to make absolutely certain, though, is the second to last point, which is that we always include action. The idea is not just to talk about a problem, but to propose action, to propose solutions, and in that way to be proactive.
And then, a very important part of this then is the audiences. Who are we trying to get the message to, and who are we trying to inspire to act? And so we looked at a laundry list of potential audiences, and we've sort of lumped them down into these 4 buckets. First is the public. It's important for the public to understand how this impacts all of us, and really be able to rally their advocacy in the general public. It's very important for the health professionals to understand that their pain and suffering is being recognized, it's being acknowledged, and that we are committed to making these improvements, and that we need all of the health professions to work together toward this end as well. Those in the learning environment need to hear about this, the learners and those who are teaching the learners. And then finally, and perhaps most importantly, again, for a collaborative like this to really be most effective, where can we leverage that no one else can leverage? And that may be at the level of the influencers. Those folks who have the authority, the decision-making, the influence over the larger system aspects, that they may not be aware of the importance of this. And so we really need to make this a call to action for those influencers to make this a priority, that the health and well-being and professional satisfaction of their clinicians needs to be a priority for their organizations and those things that they have influence over.
And finally, we want to end with the Knowledge Hub. This is going to be an entry point into our content. This is just a laundry list of things that we could post there, but I want to emphasize a couple of things. Number one, it undoubtedly should be bi-directional. We have all these networking organizations. We can gather, we can disseminate, we can discuss, we can mediate, moderate, curate, etc. Secondly, Lois and Art talked about the conceptual model. We're now thinking that the conceptual model, the last one that Art showed, may actually be, in effect, the home page for the Knowledge Hub. And, in earlier discussions, people said, this is really a multidimensional model. You can't do that on a piece of paper, but what you can do is you can do it electronically. One can imagine entering at different points, blowing up different aspects for different fields, changing them, modifying them, as time goes forward. And so we hope that will be one of the legacies of this Action Collaborative when it's finished. Thank you very much.